Dr. Amesh Adalja joins us. He's a senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. He's in Pittsburgh. Doctor, good morning to you. Let me start by talking about the Johnson & Johnson vaccine. Not as effective as Pfizer and Moderna, but still effective. More importantly, a single dose, and as Michael noted, can be refrigerated. What do you make of the Johnson & Johnson vaccine from your standpoint, and when do you think it will be authorized?
I think it's a great addition. This is a vaccine, as you said, that is a single dose, and it's something that doesn't require that strenuous cold chain. And you have to remember, when you look at these numbers and try and compare them head to head, it sort of gives you a little bit of a misleading picture. We were kind of spoiled by Moderna and Pfizer having such high numbers, 90%, 95%. But the key thing about Johnson & Johnson is that it protects you against severe disease. And that's why we're doing this vaccine, in order to protect people from getting hospitalized and protect them from dying. I think that you're likely to see it be submitted for emergency use authorization in the coming weeks, so it'll take some time before we actually have this on the shelves and have the ability to put this into people's arms.
We're hearing a lot about these overseas variants coming over to the United States. The question is the efficacy of our vaccines. Do the strains have any impact on them?
It depends upon which strain you're talking about. It does appear that our vaccines are robust against what's called the UK variant, but there's a little bit of a question regarding the Brazilian variant and the South African variant. But again, as I said before, it's really about preventing severe disease. So what it looks like is the Johnson & Johnson and the Novavax vaccines, when it comes to the South African variant, maybe protect you 50, 60% of the time from getting infected or getting symptoms from the South African variant, but they're very effective at preventing you from dying from the South African variant or needing hospitalization. And again, that's the key thing. So we may have to update our vaccines to get higher levels of efficacy, but the fact is they do protect you against what's important, severe disease.
You mentioned Novavax and Johnson & Johnson. We've been talking about AstraZeneca is out there potentially. Once we expand to having more vaccines available, how does that change the strategy of vaccinations?
Well, the strategy will change in that we'll have a bigger menu, we'll have much more capacity, so hopefully you'll see vaccination clinics be able to schedule much more farther into the future, have not as many concerns about supply. And when you're talking about vaccines like the AstraZeneca vaccine, the Johnson & Johnson vaccine, that don't require that same kind of storage requirement, you can get this vaccine closer to people. You can vaccinate, for example, in doctor's offices or in drugstores where they don't have access to a cold chain. So it will really make a major difference in how quickly we can get vaccine into the arms of Americans and also the world, because the Johnson & Johnson and AstraZeneca vaccines are important vaccines for the world, because think about how hard it is to maintain a cold chain in parts of the developing world where there isn't access to electricity.
Until we can get everybody or that majority vaccinated, we need to worry about masks still. And the CDC has obviously said on mass transit now they want to see those masks worn. It will be mandatory. What should we know about masks going forward? We've talked a lot in the last week and a half about the idea of wearing 2 masks also right now.
Well, masks are the simplest way to prevent spread of this infection, and it's something we should have been doing better from the very beginning. There was a lot of data that we didn't have at the beginning of the pandemic about the effectiveness of masks, but now it's very clear that masking does decrease transmission. But the thing is, not every mask is created equal. Some people wear flimsy masks, basically trying to check a box to get into a store. They're wearing a bandana, for example. And in that situation, it does make sense to have a multi-layered mask, which might be achievable if you double up. But if you've got an adequate mask, one that's multi-layered, that's kind of comports with what the CDC has on their website, I don't necessarily think you have to wear a double mask. But this all really underscores the need to have standards for the general public to understand which masks are adequate, which ones are inadequate. And I do think those standards are coming, so we will get better masks for the general public, and it will be critical because this is the easiest way to stop this virus, including its variants, from transmitting.
Dr. Amesh Adalja, thank you.